everyone, and welcome to the HealthLinks webinar today on violence at work, a total worker health approach to physical and psychological safety in the workplace. We'll get started. I see everybody logging in, and we'll get started here in just a moment. Great. Well, again, thank you everyone for participating in today's webinar. This is the 7th and final HealthLinks webinar of 2024, and today's topic is about recognizing the signs and symptoms of domestic violence when it comes into the workplace, and more broadly, a conversation about workplace violence and physical and psychological safety. Such an important topic. One of our speakers is going to talk about today, December 10th, being World Human Rights Day, but it's important to us not only that you know that today is World Human Rights Day, but also that we talk about human rights and workplace physical and psychological safety as part of this year's webinar series. Just a few housekeeping items before we get started. All of our participants are kept on mute through the duration of the presentation. We ask you to use the chat for technical assistance. But if you have questions for myself or any of the speakers today, please use the Q&A box for that. And if you want to test if the chat's working, I know there's lots of people that participate in our webinar series. It's great to see so many of you joining us again. We use the chat to say hello and tell everyone where you're joining us from. We've had participation from all 50 US states and over 20 countries around the globe during our HealthLinks webinar series in 2024. And so it's great to see all the names and all of the places that you all are logging in from with us today. So thank you for joining us. Closed captioning isn't available. If you need that, use your Zoom toolbar to access closed captioning. And we know how important it is for you to receive your continuing education credits. Please make sure to stay until the end of the webinar. Towards the end of the hour, we will be posting a link to the survey that needs to be completed in order to access your continuing education credits. We do send that link in our follow-up email as well. And also the webinar is being recorded, and we are going to share today's slides with everyone. So you will get a follow-up email with all of the relevant information based on today's conversation. A little bit about me and our program. My name is David Shapiro. I use he, him pronouns. I am a white male in my late 40s, and today I have a short beard, dark blue or brown glasses that are metal frames, and long brown curly hair. I run HealthLinks, which is our public health outreach strategy at the Centers for Health, Work, and Environment. We consult with businesses of every shape and size in every industry on their commitment to total worker health and safety. And our centers, the Centers for Health, Work, and Environment, is located at the Colorado School of Public Health on the University of Colorado Anschutz Medical Campus. And our centers are one of 10 centers of excellence for total worker health, funded by the Centers for Disease Control and Prevention, by NIOSH, the National Institute of Occupational Safety and Health. It's our goal to bring you evidence-based workplace health and safety information, and that's really the main strategy behind our HealthLinks webinar series. We always begin with a land acknowledgement, and so we will read that here. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what we now call Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. With this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government, and the military services, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems indigenous peoples have developed in relationships to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse indigenous peoples still connected to this land. We honor them and thank indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native peoples. We also have a disclaimer that we want to get across to all of you. The views and opinions expressed in this program are those of the speakers themselves and do not necessarily reflect the opinions, views, or positions of the HealthLinks program, the Centers for Health, Work, and Environment, or the Colorado School of Public Health. And we encourage everyone in attendance at today's webinar to attend this event to your own self-care needs as necessary, both during and after the presentation. So please engage with our webinar to the level of comfort that best suits you. A recording and summary of key takeaways will be shared after our session. And if anybody needs resources on self-care or on individuals experiencing violence, the place to go is the hotline.org. We have a QR code here up on screen, the National Domestic Violence Hotline, and the 1-800 number, which is 1-800-799-SAFE. or 1-800-799-7233. And we want to make sure you have access to those resources if you need them for any reason, both for your own self-care or for any situations that come up. And just recognize that this topic can be challenging to listen to and to hear. It is about domestic violence and its impact on the workplace. And so just reiterating, take the time you need and take care for yourself. And if you do need resources, please reach out to the hotline.org. Our agenda today is we have a keynote presentation followed by a panel discussion with speakers that do work in this field. And then we always try and leave time towards the end of our hour for question and answer session. So be being prepared for what questions you may want to ask our speakers as they're going through their presentations. And our learning objectives today are, first, we want you to be able to recognize the signs and risks of workplace violence. Be able to understand and implement evidence-based strategies to address violence at the workplace, and be able to formulate postvention protocols. And we'll talk to you a little bit more about what postvention means, but postvention protocols and support systems for employees experiencing violence and those experiencing vicarious trauma as well. I know that there's some language that may be new to you all in some of these learning objectives, and we're going to make sure we define some of these terms throughout our presentation also. So with that, I want to introduce our keynote speaker, Lydia Waligorski. Lydia currently serves as the Director of Policy and Advocacy at Clayton Early Learning, where she's focusing on the intersection of access to quality childcare and families' upward economic mobility as a protective factor against harm. Lydia's previous policy work includes leading multiple successful policy wins of Colorado's Domestic Violence Coalition for 7 years, creating the first administrative law rules for Colorado's paid leave program, also known as FAMLI, F-A-M-L-I, and working as a confidential victim advocate. Lydia has a passion for increasing access for historically excluded populations to both policy and decision makers. So thank you, Lydia, for joining us today. Give me a moment and I'll just pull up your slides.
Great. Thank you so much, David, for that introduction and for welcoming us into this space to talk about something that is near and dear to our work and our hearts. I do want to iterate what David had said before in terms of taking care of ourselves during this presentation, and really introduce you to the National Domestic Violence Hotline if you're not currently familiar with it. It is answered in over 200 languages, 24 hours a day, and it is staffed by confidential advocates, and they provide warm referrals to clients and survivors. And so that means that if I'm calling and I'm looking for resources in a specific county or jurisdiction, the hotline will answer the call and then route the person to services that are most readily available to them. So a fantastic resource. If you're not familiar with it, please do give them a call if you ever have a need. We put everything on one slide deck, and so I'll ask for thank you for those to be switched as we go. And let me back up for a second, and for our folks that might benefit from this, I am a light-skinned female. I have long brown hair that is styled straight today. I'm wearing a gray blazer and hoop earrings, and as we go through today's presentation, I'm going to try to speak slowly and clearly to accommodate our closed captioning. And for those of you who may know me, that was likely to be one of the most challenging parts of today's presentation. So I do want to acknowledge, and David mentioned this, that the timing of today's topic is not accidental, and that we are gathering to discuss workplace violence and domestic violence on December 10th, which is International Human Rights Day. This date is significant because it falls during the United Nations 16 Days of Activism campaign against gender-based violence. And this campaign begins on November 25th every year, which is the International Day for the Elimination of Violence Against Women, and ends today. And this is a global initiative to address violence and to raise awareness and drive action against gender-based violence. And so I encourage you all today after the webinar to explore this campaign more deeply. There are numerous blog posts and information and things out there specific to gender-based violence around the world. I also want to recognize that when we're talking about work, we are also acknowledging we are not just talking about paid employment, and acknowledge that unpaid labor is often carried out in the care economy by parents, family members, caregivers, and others. And these roles, though frequently invisible, are vital to our functioning society and economy. And conversations about work must include these contributions as well, because ultimately they do affect all of us. So, as David mentioned, we're going to be talking about different languages today, and we're going to be talking about violence in the workplace. And so, when we talk about violence in the workplace, we kind of think of this in terms of three buckets. And when we think of workplace violence, I think of that as an umbrella term that talks about any type of violence or threat that occurs in the workplace. It can come from anyone. It can come from colleagues, or even strangers or customers in the workplace. And it's harmful to not just individuals or individual employers, but to businesses as well. And when we think of workplace violence, we are thinking about this large umbrella term in terms of it being a serious occupational health and safety issue. And so when we think of domestic violence and gender-based violence, these are major aspects of the broader problem that is workplace violence. But we really talk about who is the person causing harm and not the person experiencing the harm when we think of these incidents. And so when we think of gender-based violence, I think of this as any term that is a harmful act that is directed at a person that is based on their gender or that disproportionately affects women. Gender-based violence includes physical, sexual, emotional, and economic abuse, and as well as severe forms like stalking, forced child marriage, and sex trafficking. This type of violence is rooted in gender inequality and the abuse of power. Risk factors that are likely to increase the likelihood of gender-based violence can include isolated workplaces, homogeneous workplaces that lack gender diversity, customer-facing workplaces, as well as cultural and language differences. The good news is each of these risk factors can be mitigated through good policy and a sense of mutual respect and belonging in the workplace. We know that gender-based violence and workplace violence are both 100% preventable. And so we will be talking about workplace violence and gender-based violence in the context of what happens in our workplaces. But really today we're going to focus on intimate partner violence or domestic violence. I've been doing this for several decades, and I tend to use those terms interchangeably. But really we're talking about violence that occurs between romantic or dating relationships, and this can be both past or current partners. And this can include certainly psychological abuse, physical abuse, sexual abuse. It can be isolated to a single incident. But intimate partner violence often expands years, with some relationships really marked by kind of chronic and ongoing abuse. And today, this will be our primary focus. We'll talk about the prevalence, the impact, and the ways that employers and colleagues can intervene to support survivors and reduce harm. I also tend to talk about people that have experienced intimate partner violence. I tend to use the term survivor rather than victim. Victim is often a legal term defined by whether or not someone has sought assistance through a criminal legal process. But beyond that, this distinction is really important because it acknowledges that the people who experience violence often regain control of their lives, and their experiences should be framed with respect and dignity. Okay, so if we go to our next slide, and I just want to take a minute to really kind of let people know the pervasiveness of intimate partner violence in the workplace and the significant toll that it takes in both the workplace and in personal lives. And for today, I was asked to focus on the impact of this in the workplace and share some of these pieces of statistics that are relevant. But as someone that has worked with survivors for decades now, and someone that has worked with employers as they navigate supporting survivors in the workplace, I do want to share a couple of stories and things that I hope stay with you that really bring home some of these statistics and let you know that almost every woman you know has a story of experiencing gender-based violence, or their best friend does, or their sisters do, and it is because it is so pervasive. I will also let you know, having worked in this field for a long time, a lot of our stats and figures are likely underrepresented. So even though these seem like really big numbers, it's important to know that less than 40% of survivors actually report domestic violence or sexual assault or seek help from systems. And we have to ask ourselves why that is the case. And the fear of being disbelieved or shamed or blamed is deeply ingrained in our culture. And many survivors feel trapped in isolation and in secrecy. And for individuals in long-term abusive relationships or those who share children with their abuser, the fear of retaliation often outweighs their perceived ability to seek and receive help. Most people do not report intimate partner violence the first time that an incident happens. They may not report partner violence the 100th time something happens. People tend to report when they've had enough, when they've feel like it is, finally a part where they're no longer able to stay and endure the situation. They feel like they have to get out and leave, but it's not a one and done incident for most people. It does take time for survivors to often report and find a way that feels safe for them, and that usually comes at a breaking point. So the impact of this in the workplace cannot be overstated in terms of, we know that you likely already work with survivors or have worked with survivors. You may or may not know that. They may or may not feel ready to disclose that information to you, and that's okay. But when we look at the impact of this in our society and the cost of this in our society, it is pervasive, and we add this to the world of work. This impact really impacts 96% of employed survivors say that they experience problems at work due to the abuse. And so if you have a survivor that is in your workplace or they've experienced abuse currently or recently, it's very possible that they may be dealing with that and maybe not feel ready or able to disclose that to their employer. And there's some good reasons for that in terms of, we know that within a year of disclosing domestic violence to their employer, most survivors find themselves out of that job within a year of disclosing. And that can be a lot of factors, including not feeling supported, not feeling safe at work, or wanting to protect their coworkers or their place of work and safety. And so the impact of domestic violence is certainly both psychological and financial. And we certainly know that, unfortunately, abusers often sabotage someone's stability at work. Work can be a place that people feel safe. They want to continue relationships there. They feel like they're good at their job and they're confident at their job, but employers often sabotage somebody's ability to stay and work. This can be making disruptive phone calls, showing up at the workplace unannounced, or sabotaging childcare arrangements. And we certainly know that childcare is very important to worker stability and to survivor stability. Sometimes abusers may even force their partner to quit that job altogether. And so finding support in the workplace matters. And so two different stories with two different outcomes here. I once worked with a survivor whose abusive ex-partner knew where she worked and he knew her colleagues. She had a supportive workplace. She had disclosed to her employer what was happening. She had a protection order or a court order saying that this person was not allowed anywhere near her. He showed up one day and asked to take her to lunch. Her coworker recognized him and said that she was already out to lunch at a very specific restaurant. When law enforcement was called, they found him at that very specific restaurant and found multiple weapons in his car. But because she had the support of her coworkers, they were able to avoid an act of domestic violence becoming a potential act of workplace violence. Contrast this with a survivor that I worked with as we were working to tell stories to the state legislature in support of paid safe leave. I worked with a survivor who was an emergency room nurse, who is an amazing, highly trained and professional woman. She was married with children, and she was married to an abusive spouse. And she recalls she felt like he would purposely bruise her in visible areas, including her face. He would also keep her awake at night, and we know that sleep deprivation is a real tactic that abusers use. And her being kept awake all night really led her to feel like she couldn't competently and safely care for her patients. And so she called out of work a lot because of this. She worked with law enforcement in the emergency room. She felt like she could not risk him being arrested because she felt like if it had gone to civil court, she was likely to have to co-parent with this person due to her work schedule. And she couldn't risk that because she felt she was risking the safety of her children in that moment. And so when she wasn't able to find support in the workplace, she felt like she had to stay quiet and keep this secret. And this really led to decreased safety and then really decreased wages and years of financial instability for herself. And so two different stories, two different solutions, really depending on how that person was being supported in the workplace. And so there are clearly immediate health impacts to this in terms of domestic violence can range from anxiety, depression, certainly physical injury, all the way up to homicide. We also have to acknowledge the long-term health effects of domestic violence, and we know that survivors often face serious physical injuries, including hidden brain injuries that are a result from repeated blows to the head or to strangulation. And this type of injury in particular has long-term psychological and physical effects. And in many cases, survivors experience neurological damage that is comparable to professional football and hockey players, but it is an unseen and hidden injury that people tend to live with for a long time. We think of psychological safety. One of the simplest, most powerful ways to support survivors is to start by believing them when they disclose their experience. Responding to domestic violence in the workplace isn't always about conducting an investigation. It's not about, does this person really need or deserve support or care, or even trying to solve the problem. It's really about offering support, understanding, and resources when someone chooses to speak out. And if you find yourself in the position of needing to support someone that has disclosed this to you, simply offering a simple "I believe you" can be incredibly powerful. It's also essential to understand that leaving an abusive relationship does not automatically ensure safety. In fact, some of the most dangerous times for survivors are when they are pregnant or after they have immediately left the situation. The process of leaving can be incredibly stressful, expensive, and dangerous, especially when children are involved, when the survivor is forced to co-parent with the abuser. This decision to report or engage in a legal system is deeply personal and not without risk. Legal systems can take months or even years to address the case, and participation in a criminal or civil proceeding is emotionally taxing. I also want folks to understand that economic security is a large part of physical safety. If a survivor loses a job or a home, the outcomes for physical and financial safety are worse before they get better. Domestic violence occurs across all socioeconomic statuses, but it is easier to stay physically safe if you can buy a flight to relocate or you can move into another place. And so this makes staying employed during a crisis involving domestic violence a really key support. We also know that women that experience a job loss due to domestic violence, it takes them years to achieve the next level of financial security, which also has an ongoing impact on their retirement and their overall safety and security. Next slide, please. And so a recent survey from the Society of Human Resource Management found that only half, or actually less than half, of organizations have any policy or programs in place to train employees on how to respond to workplace violence. And about 1/3 of workers would not know what to do if they experienced an act of workplace violence. And so that has a real toll on people that are experiencing workplace violence and domestic violence, when people are at a loss of both how to respond in the moment and how to respond to support somebody after an incident. And so we know that gender-based violence in particular costs businesses and lost productivity, legal experiences, employee turnover, and reputational damage. And these costs can be far-reaching, often underestimated. For a time, I worked at the district attorney's office, and I'll never forget sitting in court with someone who had received a summons to come to court the night after her partner had been arrested for an act of domestic violence. We would often summon people into court and ask them to give position on bond and protection order, and ask this person how they would like to be supported in the immediate aftermath of an assault. And as I was sitting with her, and this person worked for a large corporate chain restaurant association that I won't mention, but her manager was consistently texting her and saying, if you're not here at your shift time, you're fired. Even though the survivor was in the courtroom sharing a picture of the summons with her, telling her what was going on and why she was there to really support her own physical safety and her kids' physical safety. But when she disclosed, it certainly was not helpful. She felt that she, was in danger of losing her job at that moment. And we were able to support her by reminding her manager that we actually had a 3-day leave law in Colorado that allowed survivors to seek support and to go to court to make sure that they were safe. And so even though we were able to put a Band-Aid on the situation, she certainly did not feel supported in the long term. So when we talk about the lost days and the unpaid work, again, this is likely a smaller number than what is actually out there when we think about the rate that people actually disclose and are able to share this information. But the good news is there are some really solid evidence-based policies that you can help people through intervention and help them achieve safety and really avoid most of the negative impacts of the financial fallout from experiencing gender-based violence or domestic violence in the workplace. The first thing to do is to adopt written policies. If it's not written, we run the risk of one person getting access to a policy and the other people not knowing that it exists. And so adopting a written policy ahead of time is really a great idea in our understanding and our ability to respond to an incident. And so we also want to think about knowing and sharing available resources that are available in your state with your employees. And so in Colorado, we have paid family medical leave, which we will be talking about in a moment with my friend Molly. But it's important to put this out as an employee benefit, to really educate people as to the availability of support during onboarding so that there's no question for them when they are in a crisis. It's also really important to educate managers once a year on this. I had a very well-meaning manager tell a survivor one time that she would help her by approving her leave, but only as long as she agreed to divorce her spouse, which is really problematic. It's probably not a legal option to bring that into the workplace, but training your managers can certainly help keep your business out of litigation and can help be supportive in the moment. Providing flexible work arrangements when at all possible is really helpful in terms of assuaging both gender-based violence and intimate partner violence, in terms of making sure that people feel that they are available to seek help and be in physically different locations when risk presents itself. And so if we can reduce the risk by removing somebody from the situation, that's always a helpful support. Access to childcare is really important to keep workers employed during a crisis. We know that workers sabotage childcare a lot, and it's really can mean the difference between someone being able to stay employed versus needing to find another arrangement. Paid leave and FMLA options. The Family Medical Leave Act has been used for a long time to support survivors. There should be no time limit to access, and then no conditions as to relationship status. And so Sabrina was going to talk a little bit more about the economic work that she's been doing to support survivors. I thank you so much for your time today, and I look forward to your questions.
Thanks so much, Lydia. Really appreciate you helping us frame the conversation with some of the data. There's a couple things that came across on your presentation before I, introduce our next speakers that I just want to convey to our audience. One is, as colleagues, as human resource professionals, and we say this in a number of settings, it's not our job to diagnose or treat anyone in what they're going through. It's really to be a compassionate and caring human being, to be willing to listen and share resources and support for someone as you would a friend, a neighbor, a family member. And that's one thing that's come across here is, I know we're introducing some new terms to everyone today. It's not here, you're not expected to become an expert on what these terms are and what individuals are going through, but the more compassion and caring we can give to individuals who may be experiencing this, the better. And the other thing I want to mention, and I've been an ally in this space for a long time, is while our presenters are all female or identify as women today, I really feel like domestic violence is a men's issue. And so for my male colleagues that are joining on today's webinar, think about how you can be an ally and an upstander in this space. It's really not appropriate for us to continue to rely on women to be describing these experiences for us. And so I encourage you, and if anyone wants to reach out to me directly on other ways that men could get involved in this topic, I'd be happy to provide you with additional resources there. So with that, I'm going to introduce our second speaker of today, which is Sabrina Ham. Sabrina joined the Free From team in December of 2019. She leads their systems change initiative with the goal of passing survivor financial security-centered policies across all levels. Sabrina is committed to and passionate about economic and racial justice. She worked with a number of policy organizations on issues such as affordable housing, access to school meals and social services, and as a former Emerson Hunger Fellow in the 18th class, she helped to improve CalFresh and SNAP access for people who are unhoused and worked to increase school meal participation rates among children living in poverty. Sabrina also holds a Bachelor of Arts in Peace and Conflict Studies from UC Berkeley. In her free time, she enjoys baking, yoga, and hiking, and she rarely says no to adding a new plant into her home. So thank you, Sabrina, for joining us today as well. Let me call back up the presentation for you.
Yeah, thank you all so much for having me. I'm very excited to share a bit more about Free From's work and our recommendations. So I'm Sabrina Ham. I'm a mixed race woman, identifying women, have long brown curly hair. And in case you're not familiar with Free From, we work to create pathways to long-term safety for survivors of gender-based violence, really focused on that intersection of financial security and gender-based violence. On the next slide. Thank you. So the way that we approach our work is that we understand the financial devastation and impact just merely being subjected to some form of gender-based violence has on a survivor. And so 84% of survivors report not having enough money is a #1 obstacle to their safety. The CDC estimates that on average, a cis woman will incur nearly $104,000 just to get $104,000 simply by being subjected to gender-based violence. And that number only includes job loss and medical care. It does not include economic abuse, and economic abuse is financially devastating for survivors, and nearly 99% of survivors will be subjected to some form of economic abuse. And so economic abuse, as Lydia mentioned earlier in her presentation, that it looks like preventing a survivor from accessing resources, from going to work, obtaining education, or anything that can further their financial security and independence. It can look like monitoring and controlling someone's bank account. And so we know that a lot of survivors may be the sole breadwinner, but they may not even have access or control or say over the financial resources of that household. And in a study that we found that we did in 2020, which I'll share in the chat shortly after my presentation, is that harm doers have incurred over $16,000 of coerced debt, and it's nearly $16,000 of coerced debt in a survivor's name each year. And so that means we're forcing a survivor to take out, for example, a credit card or a car loan through coercion or without their consent. And so we know that access to safe and affordable credit can have really strong implications on someone's access to job or future housing, rental applications, things like that, because our credit score really impacts our ability to apply for a rental unit or safe and affordable credit options. On the next slide. So just over a year ago, we surveyed over 2,000 survivors in our network to ask them, what is the impact being subjected to gender-based violence had on them in the workplace? And we also asked them what resources, services, support systems their employer can do to better support them as survivors. And I won't read every single one of these, but just wanted to highlight a couple of them. So 90% of survivors said that a harm doer has disrupted their ability to obtain or maintain a job. And 84% of survivors said that gender-based violence negatively impacted their job performance. And so whether the harm may not be happening directly at work, but it is impacting an employer and their ability to stay employed, their ability to perform really well on their job duties and things like that. And on the next slide. Thank you. And so what this means is that it's not enough to simply help survivors find a job, but it is also important for them to stay employed. We know that the number one obstacle to long-term safety for survivors is financial security. And so this means that employers have the ability and the role to create policies and benefits that are tailored to meet the survivor's unique needs and circumstances so that they can stay and maintain employment and deal with consequences of abuse without risking their job security. On the next slide. And so I just wanted to pull out in that survey again, just a few things that survivors told us, things that would help them. So if you are in a position to advocate for better workplace policies or adopt better workplace policies, or even amend some of the ones that you have in place, please keep these in mind. And so 96% of survivors said that emergency grants, emergency grants that employee does not have to pay back. So maybe there's an option for employers to offer safety funds or emergency grants to help survivors in a moment of acute crisis. As mentioned before, paid and protective safe leave. We have savings matching program. Maybe an employer can help survivors continue to build their financial security through things like building their savings and flexibility. So working from home, working at different hours based on the survivor's unique needs. Sometimes it could mean maybe not having a customer-facing role, being able to be flexible in their schedule. And on the next slide. And then just a few other things that I wanted to highlight, things like a 401k matching program so that they can build their long-term safety, peer-to-peer groups. So maybe there are other survivors in other coworkers who are survivors and want to provide a safe and confidential space for them to share resources, support each other, and talk through situations, and just really be a strong support for fellow colleagues. Emergency loans in this way would be being paid back, affordable and accessible childcare options, and flexible options for receiving paychecks. And folks may be like, what does that mean? Or I'm trying to understand that more. Is that, as I mentioned before, economic abuse is really pervasive, and that a survivor may again be a sole breadwinner or have the higher income, or gender-based violence happens across all socioeconomic status, but just wanted to highlight um, that flexible payment options allow survivors who may be subjected to economic abuse to have safe access to their money. And so, maybe a direct deposit is safe in one moment, and in another moment they need to switch to a paper check or another option. And so providing those the multiple options for survivors and being flexible on how often they can change that, because survivor situations can change really quickly. And I wanted to share before I close a quote from a survivor in our network to really ground us in this conversation. Survivors are competent and capable despite being overwhelmed by circumstances. If you empower them and believe them, then believe them when they tell you what they need, i.e., a more flexible schedule, ability to work from home, more resources, etc. They will show up and work hard. Survivors want to succeed and contribute value in the workplace. Next slide. And if folks are interested in talking in more detail about what these policies looks like, what these policies and resources could look like, we'd be happy to offer ourselves as support and guidance, share the resources and model policies your way. Thank you so much.
Thank you so much, Sabrina. And we'll make sure that all participants have contact information for the organizations that are participating today as well. With that, I'm going to introduce our third speaker of today, who is Molly Weston Williamson. Molly is a senior fellow with American Progress and a nationally recognized expert on paid leave policy. Previously, she was the director of paid leave and future of work at A Better Balance, where she led A Better Balance's advocacy around paid leave laws across the country and directed A Better Balance's efforts to address the needs of all workers in a changing workforce. She was appointed by Governor Ned Lamont from Connecticut as the inaugural member of the board of directors of the Connecticut Paid Family and Medical Leave Insurance Authority. She's been quoted in publications such as the New York Times, Slate, and Consumer Reports, and her academic work has appeared in the Yale Law Journal, the NYU Journal of Legislation and Public Policy, and the Connecticut Public Interest Law Journal. She clerked for the Honorable Thomas L. Abro of the Third Circuit Court of Appeals and graduated Phi Beta Kappa with honors from Swarthmore College and received her JD from Yale Law School. So thank you, Molly, for being with us today and talking with us a little bit more about paid safe leave as an option.
Thank you so much. My name is Molly Weston Williamson. I am a white woman with long dark brown hair. My co-presenters have so nicely teed up a lot of the challenges that survivors are facing in the workplace, and I'm excited to focus in on one of the supports that employers can offer to help respond to those challenges. And that is paid safe leave. That's paid, protected time off from work to be able to address the impacts of violence. And when we say protected, what we mean is you're not going to be punished for using this time. You're not going to be written up or get points or occurrences. And most importantly, you're not going to be fired for using that time. Paid safe leave is also the law in a growing number of states and cities around the country. So there are 17 states in the District of Columbia, along with a number of cities and counties that have paid sick and safe time laws on the books, including Colorado. There are 6 states that have provided more extended paid safe time through paid leave insurance systems, again, including Colorado, which is a leader on these issues, including but not limited to, because of my co-presenter Lydia. There are also 17 states and DC that have unpaid safe time laws, so laws that don't require this time be paid but provide important additional protections. Don't let the fact that it's the same number at the top and bottom of this slide fool you. Those are overlapping lists, but not exactly the same states. And I want to highlight these laws both because folks who are employing people in these jurisdictions should be following the law, but also because I think the prevalence of legal requirements for these protections really emphasize how important they are, how well recognized they are, and can give you some really important models for how to provide them. So if you can move to the next slide. So what is paid safe time for? Like, what are these needs that folks may need time off from work to address? This can be for things like accessing supportive services, so from a victim service organization or a crisis center. A really important one is time to relocate to safety, so to either secure an existing home or to relocate to a new home in order to pursue safety. Time, as the example that Lydia was highlighting, points to attend or prepare for legal proceedings or to get legal services, which may be in the criminal legal system, that may be in civil courts, such as to get a protective order. This could be for custody hearings. So time to address those needs would typically happen during the workday. Time to get physical or mental health care for needs in relation to the violence. Time to engage in safety planning, so to make the plan that allows you to pursue the safety. And as my co-presenters have highlighted, we know that childcare is a really critical part of pursuing safety and of that economic security. And so for many survivors, one of the things they need time for is to rearrange that. So to enroll a child in a new daycare or a new school, again, as part of that pursuit of safety. So these are examples of the kinds of needs people may need time off from work to address. If we head to the next slide, another key piece to know is that while, as Lydia highlighted, folks are employing survivors whether they know it or not, safe leave isn't just for survivors. It is also for survivors' loved ones. And that's critically important because we know that support from family and friends is a crucial tool for the pursuit of safety. It's a crucial response to isolation brought on by abuse. And so safe leave laws typically also allow friends and family members of survivors to use the leave to support those survivors with the same needs. So that could look like you're taking time off work to help a loved one move to pursue safety. You're taking time off from work to drive that person to get the healthcare they need. It could be, as we were talking before, about how difficult the court process can be. It could be time off to sit with your loved one to support them while they are in court. So I think when we're thinking about what is the scope of protections people need, and not just what's the baseline provided by the law, but also what should employers proactively be doing, we should be thinking about safe leave not only for survivors themselves, but ensuring those policies also allow leave to be used for those same needs to support loved ones dealing with violence. And last, on our final slide on this topic, I do just want to highlight that in addition to safe leave being the right thing to do, the right way to support survivors, and in addition to safe leave in many places being the law, safe leave is also good business, because what we know is that workplace leave policies are important tools for recruiting and retention. They're a way to ensure that employers are able to keep the employees that they have invested in, that they have trained, who are delivering for their business, rather than losing them when they are forced out of the workplace. And we know that that has important bottom line impacts for employers because turnover is really expensive. It's expensive to recruit people, it's expensive to train people. And the person who has been doing this job for a long time is always going to be more productive for you than someone who is new in the job. And so I think when we think about the employer perspective here, we should absolutely be starting from and centering the needs of survivors and their loved ones. But this is also a situation where doing right by survivors and their families is also doing right by the business. So thank you so much. And I believe it's time for Q&A.
Great. Thank you so much, Molly. I'll invite all of our presenters back onto the screen, all of our speakers today, for the next 10 minutes or so for Q&A. There's a great discussion going on in Q&A. Some of the questions have been answered already, so thank you for the questions that you're asking. And resources, we have links and are starting to provide those in the Q&A section. But I'm going to start with the question that's currently top of the list on Q&A from Terrell. And I think I'll start, Sabrina, with you in terms of response to this question. So let's say I work at an organization where there are not official written policies, but provided by the organization leadership. What's one thing that you want individual managers to know on how to work with their direct reports and still support them? We've gone through a number of resources today. I've already heard, be a good active listener, be supportive and validate individuals. But, in addition to those kind of recommendations, what's something that we should know about as in a managerial role if our organization doesn't have any policies?
Yeah, thank you so much for that question. I think, as mentioned earlier, first and foremost, trust the survivor, and let them lead the way. Sometimes, like, we at Free From firmly believe that survivors are experts in their own experience. And so, you know, avoid making assumptions on what a survivor might need or want and simply ask them. And if your workplace doesn't offer sort of any support, maybe there are things within the current system. So, is there sick leave or paid time, or some sort of leave option that allows a survivor to make use of those? Can you offer reasonable accommodations? And so, maybe they can switch the schedule or move to a less front-facing customer service oriented role. Maybe they can, come in, maybe they can switch their hours a little bit. And so I think that's a conversation that you can have directly with the survivor to see what would best fit them. And then you can be creative in seeing what the current workplace policies you all have and how what currently stands can better support them.
Yeah, thank you for that answer, Sabrina. I really appreciate it. Lydia, I'm going to see if you have anything you want to add to that in just a moment, but it reminds me of a lot of conversations we have about supporting individuals with chronic health conditions. And I know that that is a separate category, but generally our recommendation, once again, is we're not here to diagnose or treat as a coworker, even as a human resource professional. We're here to sit beside someone, to validate and to listen and to help them get access to the resources they need. And remembering too that this is a particularly stressful experience, both physically and psychologically for individuals. So they may need assistance making the phone call, clicking on certain web links, and being able to stay attentive to some of the information they're providing. We talk about this a lot with a variety of mental health conditions that people are diagnosed with, or if you followed any of our work on supporting individuals in recovery from substance use disorders, they may need someone to just help make the phone call with them. And being that type of supporter is really important as well. But Lydia, for the organization that doesn't have official policies in place, we can advocate for policies at the organizational and even the statewide level. But what's something you want managers and other individuals to know on how to work with direct reports here?
Yeah, thank you so much. And that's a great question. So, I think it just goes back to believing that person and being that supportive person. And really, David, as you just mentioned, like, you don't have to be the expert on this, or you have to help them get the care and kind of access the care that they may need to be looking for. And so being a supportive person and letting them know that your support is not conditional on how they respond to or address the violence in their own lives, that you are a safe, supportive person, and that you are here to offer resources and help make those resources available is really the best thing that you can do, by really honoring that survivor is the expert in their own lives and the expert in their own experience and should be the one to direct what happens next.
Great, thank you. Molly, I'm going to shift gears and throw a topic to you that I don't know if you've done any research on, but there's a questions here about mandatory reporting policies. And paid safe leave is one thing, but I'm just curious if Center for American Progress has done any work or research on, okay, if someone's disclosed to me that this is their experience, what am I required to do with that information? I don't know if that's part of safe leave or if you have any other thoughts for individuals of when someone discloses and shares. We've gotten some of the personal aspects of how to support individuals here, but what are some of the other potential legal requirements that people may want to think about?
So I think the thing to highlight with safe leave is it's sort of the opposite.
Hmm,
Because the goal with safe leave is it's a confidential resource. So
got it.
that if a worker is disclosing something to you in connection with a need to access leave, what we really want to focus on, I think this is a good flag to highlight for employers thinking about their own policies, making sure that that information is kept fully confidential, making sure that that information
Hmm,
is kept confidential within the workplace. so that other folks within the employer who don't need to know that information are not having access to thinking about separate records. And I think here that really goes to a situation in which we don't want to be putting conditions on survivors' ability to access protections, but also I think to my co-presenter's point, we want survivors to be in control of what's happening with their information about what steps they are choosing to pursue or not pursue at that particular moment. My co-presenters may have more information about specific mandatory reporter conversations, but I think that's really the sort of watchword here, is that the goal is that we're letting survivors drive what is happening rather than employers who, as you said, are not the experts, right? They are not the experts in what the right step is, and also it's not their lives we're talking about.
Yeah, thanks so much for bringing that up. Lydia, do you have anything you want to add on mandatory reporter policies? I know you were feverishly typing a response while we were having that conversation.
I do, and thank you. And so mandated reporting is really tricky, and it's usually limited to just child abuse situations. And so Colorado used to be one of 3 states that had a medical mandated reporting law that said if I seek treatment for an act of domestic violence from a healthcare provider, that healthcare provider was then supposed to report that to law enforcement. And what we found from decades of having this policy in place is that it had a chilling effect on people's ability to seek health care or even preventative things, because they were so worried about the confidentiality and so worried about an arrest or a criminal justice implication that they were not ready for. And so I worked to repeal that law in Colorado. It's now only on the books in 2 other states, and there have been repeal efforts in both of those states, because we understand and know that while it sounds like it could be helpful, it's actually counterproductive to ensuring confidentiality and sometimes the best interests of the survivors. And so I dropped in the chat a great resource from our friends at Futures Without Violence, who have done a lot of work on repealing the California law.
Great. Thank you, Lydia. One more question, Sabrina. I'm going to start with you on this. You've shared some resources from Free From on this question about what I'm going to frame as intersectionality. If I'm an individual from a historically minoritized population, I guess, am I at greater risk of experiencing violence? And if so, are there things that workplaces need to think about and look out for when we're talking about, historically marginalized or, individuals with intersectional identities on the sort of power wheel? And how does that come into play with this conversation?
Yeah, thank you. And what I shared in my slide earlier is that 1 in 2 trans folks would be subjected to some form of gender-based violence in the lifetime. And so if we look at the intersectionality of someone's identity, sexual orientation, gender expression, I think the resources and the resources and services and the unique needs may vary. We know that BIPOC survivors and LGBTQ plus survivors are less likely to seek traditional services, mostly because sometimes they seem to like just they tend to seek sort of more traditional services for a variety of reasons, and so that I think thinking about, are there culturally specific or catered services to those marginalized communities that can better support them? I think they have unique needs and have very, different situations. And so again, just really think about a survivor, and if maybe there's particular resources that you know of, but I think also think about if there's any specific to certain marginalized communities. There's culturally specific resources out there, and think through that.
Thanks so much, Sabrina. We'll make sure that some of the resources we share, and I'm sure the hotline.org has resources for specific backgrounds and people of different, race, ethnicity, gender expressions, sexual orientation, et cetera. And so, it's the same narrative as we talked about before. Each individual is a human being. They come with their own set of circumstances and life experience. And the more we treat people like people and get them the individualized support they need, the better. We're really excited. So thank you, first of all, Lydia, Sabrina, and Molly, for a really important conversation today on December 10th on World Human Rights Day. It's really an honor and a privilege for me to be able to participate in this discussion with you, and lots of things for me to consider as well. We're excited that we are announcing the launch of the 2025 HealthLinks webinar series today as well. As I mentioned, this is our 7th and final webinar of 2024, and we've published the list of webinars. It's up on my background now of the conversations we'll be having in 2025, including kind of a conversation that sort of dovetails off of this one, which is supporting working parents and caregivers in the workplace. There's been some work by the U.S. Surgeon General and others on what is a family-friendly workplace in this era of work domains. How can we support caregivers in the workplace? And so we're going to have a conversation on February 19th about supporting working parents and caregivers. The time of our webinar is at 11 a.m. Mountain Time, so whatever time zone that is for you. But you will be provided with a link as you log out today, not only to complete the survey, which should pop up as you leave today, but also there's a link in the chat as well to complete your continuing education credits, the information we need to send you your continuing education credits, and then also an invitation to register for the first of the 2025 series. So it's been a wonderful year. Thank you so much for all of our participants for joining us over the course of the year. Thanks again to Lydia, Sabrina, and Molly for your conversation and comments today. Everyone have a peaceful, a safe, and a happy, healthy holiday season. And we look forward to seeing you in 2025. Thank you.